I had a patient come into my clinic last week, 62 years old, getting more breathless every month. Her GP had put it down to her COPD getting worse. She had stronger inhalers, new ones, still getting worse. When I sat with her and actually listened, I mean a proper history, not a rushed 10-minute NHS appointment, I spotted something. She was sleeping with 3 pillows just to breathe at night. Her ankles were swollen. She had been waking up gasping for breath. That was not her lungs playing up. That was her heart. Here is the problem. Breathlessness from your heart and breathlessness from your lungs can feel almost identical, but they need completely different treatment. And if you are treating the wrong one, you are not just wasting time, you could be letting something serious get worse without even realizing it. I am Dr. Suman Paul. I am an NHS Consultant Respiratory Physician, and I also run a private clinic here in Liverpool. I have assessed thousands of patients with breathlessness over the last 15 years. In this video, I'm going to give you 5 clues I use in my clinic to start separating heart breathlessness from lung breathlessness. The same 5 clues I used with that patient last week. Before we go any further, 2 important things. First, I am a doctor, but I am not your doctor. This video is for education purposes only, not personal medical advice. If you have severe symptoms right now, chest pain, breathlessness at rest, lips turning blue, call 999 immediately. Second, the patient story I just shared is a composite example from my years of clinical experience. It is not one specific real patient. Confidentiality is everything in my work. Now let us get into it. 5 clues. Walk through all 5, and at the end I will tell you exactly what to do. Clue number 1 is the position problem. Does your breathlessness get noticeably worse when you lie flat to sleep? Are you propping yourself up with 2, 3, maybe 4 pillows just to breathe comfortably? Have you ever woken in the middle of the night gasping for air and had to sit on the edge of the bed to recover? If any of that sounds familiar, that is a massive clue. We call this orthopnoea in medicine, and it points strongly towards your heart. Here is why it happens. Think of your heart as a pump. When that pump is weak, which we call heart failure, it struggles to handle all the blood coming back to it. During the day, when you are upright, fluid tends to sit in your legs. The moment you lie flat, that fluid sifts up into your chest. A healthy heart pumps it away without thinking. A struggling heart cannot keep up, so fluid backs up into the lungs. Think of your lungs as a sponge. Upright, fluid pulls at the bottom. Lie flat and it spreads through the whole sponge. There is no room for air. That is why you wake up gasping for breath. And the moment you sit up, gravity pulls that fluid back down and you start to feel better almost immediately. With a lung condition like COPD or asthma, position usually does not make that dramatic a difference. The breathlessness is more constant. It does not spike because you lie down. So if you are sleeping with more pillows than you used to, or waking up breathless and needing to sit up to recover, write that down. Clue 1 is pointing at your heart. Now that clue 1 was important, but here is what you need to understand. These clues stack. The more of them you have together, the clearer the picture becomes. Let me show you clue number 2, the swelling signal. Look at your ankles. Are your socks leaving deep marks at the end of the day? Are your feet or lower legs looking puffy? Is the swelling better in the morning and worse by the evening? This is called peripheral edema, and it is caused by the exact same problem as the positional breathlessness we just talked about. A heart that is not pumping efficiently. When the heart struggles to push blood forward, pressure builds in the veins, returning blood to the heart. That pressure forces fluid to leak out into surrounding tissue. Because of gravity, it pulls at the lowest point, your ankles and your feet. Here is why this matters as a differentiator. Significant ankle swelling is much less common with pure lung conditions. If you have breathlessness and swollen ankles together, heart failure is a very likely explanation. Your body is living visible evidence. Do not explain it away as being on your feet all day. If it is new, if it is getting worse, and if it is happening alongside breathlessness, that combination needs to be seen. Clue number 3 is the cough. Both heart and your lung problems can give a cough, but the type tells a very different story. A heart-related cough tends to be dry. It is persistent. It can come with a wheeze, and this trips people up constantly because they assume wheeze means asthma. We actually have a name for it in medicine called cardiac asthma. It is not true asthma. It is fluid backing up into the airways and narrowing them. Crucially, this cough tends to get worse when you lie down, and in the most serious cases, it produces a frothy, pinkish sputum. If that is happening, that is an emergency. Please call 999. A lung cough, like you would see with COPD or asthma, is typically productive. You are breaking up mucus or phlegm. It has been there for months, maybe years, often worse in the morning, and it does not really change based on whether you are lying down or standing up. To keep it simple, dry cough, worse on lying down, comes with a wheeze and ankle swelling, think about heart. Chronic, phlegmy cough, day after day, regardless of position, think lungs. 3 clues done, 2 to go. And the next one is about what happens when you actually try to do something physical. Because the pattern here is one of the most telling things I look for. Stay with me. Clue number 4 is the exertion pattern. How does breathlessness hit you when you are active? With a heart problem, there is often a sudden, disproportionate exhaustion. You go to carry a bag of shopping from the car and you are completely wiped out. Dizzy, heart racing, maybe a pounding or fluttering sensation in your chest, what we call palpitations. The change can feel quite dramatic. Something you managed easily 3 months ago now floors you. Think of it this way. Your heart is the engine. When the engine starts to fail, the whole car loses power. Suddenly, it is a system-wide shutdown. With a lung condition, the breathlessness is usually more gradual and predictable. Someone with COPD might notice over years that the same flight of stairs takes more out of them. They are huffing and puffing, fighting to get air in through the narrowed airways. But the whole body crash, the dizziness, the racing heart, less typical. If your breathlessness with activity feels new, sudden, and comes with extreme fatigue, lightheadedness, or a racing heart, please get your heart checked. Do not put it down to being unfit. Clue number 5, and this is the most important one. How did your breathlessness start? If it came on within minutes, especially after rest, that is a medical emergency. Call 999. Do not drive yourself. Do not wait to see if it passes. Call 999. This could be a heart attack. It could be a pulmonary embolism, a blood clot in the lung. Both can be fatal if not treated quickly. The red flags I need you to know are sudden severe breathlessness at rest, chest pain or pressure spreading to your arms, jaw or the back, feeling faint or confused, lips or the fingertips turning blue. Any one of those, call 999 right now. If your breathlessness is more gradual, building over weeks or months, that is different. That is when these 5 clues become your guide, and that is when you need to see your doctor and get properly assessed. So here is exactly what I want you to do next. Go through these 5 clues, write them down if you need to, or save this video. Is it worse lying flat? Are your ankles swollen? What kind of cough is it? What happens when you exert yourself? And how did this all start? Take that story to your doctor. You will be giving them a much clearer picture than most patients can. When you see them, they will examine you and may organize some tests. An ECG looks at the heart's electrical activity. A blood test called BNP shows whether the heart is under strain. A chest X-ray reveals fluid on the lungs and the size of the heart. A breathing test called spirometry can diagnose COPD. These are simple, painless tests, and they can completely change your management. If you have been getting that runaround, told it is anxiety, had your inhaler changed but nothing is improving, this is exactly the type of issue I help people work through at my clinic. If you are tired of not getting answers, you can book a comprehensive respiratory review with me. The link is in the description box below. To read 5 clues. Is it worse lying flat? Are your ankles swollen? What kind of cough? What happens with exertion? How suddenly did it start? Breathlessness is your body sending a signal. You deserve to understand what that signal means. Please do not ignore breathlessness that is sticking around or getting worse. It's not just a normal part of getting older. You are never wasting anyone's time by getting it checked. Go get it looked at. If this video helped you, subscribe, because I post videos like this every single week to help you understand your respiratory health and take control of your breathing. And leave a comment below telling me which of these 5 clues was new to you. I read every single one. If you know someone who has been struggling with unexplained breathlessness, share this video with them. It could genuinely make a difference. I will see you in the next video.